Greetings, this is Advocates Global News for 2/24/2020, and more news about the COVID-19 coronavirus, the new numbers and what the new numbers mean. So I start analyzing this every day by looking at the Baidu site, and again, I think this is the third day in a row I actually captured this chart at the top of the Baidu site, which there's a link below. And the chart has the changes from yesterday, which is, it only happens for a few hours a day. Late in the evening, or actually lately past midnight till like 4 in the morning China time, is when they finally publish these numbers, and then they give you the delta from yesterday, the change from yesterday. And then after a little while, they wipe out the deltas and start a new day. So in the new day, the larger numbers increase, usually every day, or decrease, and the delta numbers disappear. They're turned to zero again. So if you scroll down from that chart, the first thing you see is this map of China. And of course, every day, China has the islands in the South China Sea listed as part of their country, even though everybody knows that's a pipe dream. So again, this is the same page, but if you scroll down, first you're going to see that chart with the numbers, the totals, then you're going to see the map, and then you see two graphs. This is the first graph, and this is new confirmed and suspected cases nationwide. So in the gold, you have suspected cases, which there's 530 new suspected cases today, and 517 diagnosed cases today, confirmed cases. And these are both really low numbers. As you can see, the left side of the graph, there were periods that went by where we were over 3,000, over 4,000 even new cases a day. And that's drastically down. And a big spike there is due to that data change where they went from blood tests only to other diagnostic tests, and they added that all in one day, and it was 15,000 cases that they added in one day. So that's what that spike is for. But if you take a look at this, it's generally a downward trend in both of these, so that's good news if it's true. And this is the second graph, and up there where it says Africa. When you see Africa, just think of the whole of China. So obviously the word for Africa, the continent of Africa, and the word for like the entire country are similar in Mandarin, because I've used a couple different translation apps, and it keeps coming back Africa. So that's what you get when you translate this to English. But what this means, the gold number is new confirmed cases outside of Hubei province. And you see a big spike there, and the reason that spike doesn't affect the country that much is because Hubei is like 95% of everything that's going on. Their numbers are so huge, they affect the whole country. So the Hubei curve is really close to the China curve. The Hubei curve for new confirmed cases is in the pink, and the red is entire of China. So you can see that the rest of China spiked quite a bit here, and it ended up being a spike in China. Of course, it didn't affect Hubei because this is provinces outside of Hubei, the gold line. But spikes in the gold line aren't going to affect the red line as much as spikes in the pink, which is Hubei province. So as you scroll down, the next thing you see is a list of provinces in China, and it defaults to being open for Hubei. So you see underneath Hubei all of the cities in Hubei province, which Wuhan is one, and the biggest one, and the capital. And if you close that, you can see all of the rest of the provinces. So number 2 province now is Guangdong, which is a huge population province in southern China, just north of Hong Kong, and includes Shenzhen and also Guangzhou on the east and west of the province. So those are both cities in the top 5 in population in China. So I explained this yesterday, why we have a spike in Henan and a spike in Heilongjiang province, which is where Harbin is, which is where the International Ice Festival is. So that festival went on for a few days before China closed it down, because why did they close it down? Because China closed down everything. China closed down the celebration of Chinese New Year and said everybody stay at home. So that's why that ice festival got closed. But unfortunately, it was open from mid-December till about mid-January before it was closed, and a lot of people were in contact with each other. So that's why we see a spike there. So these two numbers, remember them, 19 and 12. These are really big numbers for a province outside of Hubei. And why that's alarming, we'll see when we take a look at Western countries next. And then if you scroll down a little bit more, you see these real-time stories. This is, Baidu is a search engine like Google. So what they do is they get all of the search terms used to look up stories and rumors that people search for using, the Baidu search engine. So the number one topic every day that people search for is the data that we just showed you, all of the charts up above. Number 2 is Dali expropriation Chongqing mass. So that was an interesting story, so I had to look it up. And in Chinese method as a method proved successful. I looked that one up, and some of these are old stories. They were number 1 or number 2 yesterday. And in colleges and universities. So let's take a look at some of these stories that are hot topics in China. Okay, so the first story we had was the city of Dali, and this is an investigation that was done by either the Central Communist Party or the Province Party under the order of the Central Communist Party. But there were some people, and it says here, let me just read part of this. The illegal seizure and requisition of epidemic mass in Dali City is true. The plot is bad and serious. It interferes with the overall situation of national epidemic prevention work, seriously undermines the epidemic prevention discipline, seriously damages the image of Yunnan epidemic prevention work, and exposes the Dali Municipal Party Communist Committee and municipal government. So what happened here was these people were replaced, by the way, but they were going out basically and stealing mass so that their city had enough. So they're getting mass from other places, and that was that broke the news. And those, like I said, the leadership of the city of Dali was replaced, and it would probably be really bad to be them right now. The second story that we saw about the Chinese method, this is a guy, when you look at the search terms, sometimes you can't figure out what they are. And then when you click on that link, you see the actual story, because some people didn't use the correct search terms to try to find this. But this is the number 2 topic of the day. And this is the Chinese method is the only method that proves successful. And this is a WHO guy who's talking about, the methodologies being used in China now. In other words, locking down cities, locking down people inside of their homes, and all that stuff is working. It's the Chinese model, and it's working. And, this is true. I mean, the guy came out that, the day after we had massive issues in, South Korea and Iran and Italy, that's 3 countries that weren't prepared and aren't using any methodology. Well, they are now, but, they didn't have anything in place, and this virus took them by surprise, and now they're facing, really big numbers. We'll take a look at that later. So naturally, this guy comes out and says, hey, the Chinese method is the only method that's successful, so other countries should start following this. Now, there's nothing wrong with what the United States is doing now, but we don't have an epidemic. And, what the U.S. is doing now is, when somebody gets confirmed with coronavirus, they're picked up in a little pod that's put in an ambulance that's taken to a hospital, they're isolated right away in the doctor's office or at home, and they're not going to infect anyone. And then the third story that I wanted to point out today is schools do not open until epidemic situation is under effective control. This includes universities and schools. So there's no schools going, there's no university classes, no universities are open, no schools are open in China right now. That's a mandate by the central government. Then next, after taking a look at Baidu, Baidu covers only China. And this is Johns Hopkins. This is a research institute at Johns Hopkins. And I don't know if it's Johns Hopkins University or the hospital, but both have research institutes. And what we see here is a global look at it's a coronavirus tracker on a global level. So we have total confirmed now up to 79,572. According to these numbers. And the first thing I do with this is take a look at Baidu's current number. So as you can see, Baidu is reporting 77,779 for today, and we had them at 77,154, so it's up several hundred. So that means the total confirmed cases for today would be over 80,000. So this is the first day we've reached 80,000, although the numbers don't reflect that right now. And then other things you can look at on this chart. On the right, you see total recovered, which is a better description than what China has. China uses the word cured, and naturally everybody that gets this coronavirus, the vast majority, since the fatality rate or the mortality rate is 2.5%, that means most people recover, right? So most people just have flu symptoms and stay in bed a couple days, and then they're better, and they might have a lingering cough or something like that, but they recover. So this uses recovery. So total recovered 25,380 some. I moved that over so I could see the chart underneath it. And total deaths were at 2,630 now, which is more than SARS and MERS combined, and not good, but it's not going up very much every day. And then we have mainland China is 77,779, and underneath that number you can see the numbers for all the other countries, which is something that I also take a look at and try to figure out which news stories or what news stories can explain these. So the biggest change here is the same as yesterday, and I went over this yesterday. I'm not going to go over it again today, but if you look in yesterday's video, Fox News got all three of these in one story. So that was pretty convenient because I usually have to search all over the internet to find news stories to back these numbers. So South Korea, no change from yesterday, 833 cases. And in South Korea, all of this is due to some Christian sect, thousands of people, and they're, it's like a commune, a Christian commune that's inside of the city of Daegu, and that's a city in southeastern South Korea, and things are out of control there because of that religious sect. And in Italy, things were out of control in northern Italy and some provinces in North Italy. And now it has spread to other, major cities in Italy. And that was explained yesterday too. And in Iran, 61, this is just, a virus that hit Iran and took them by surprise too. They actually have 50 deaths in one city. Which, remember those numbers, 12 and 19? Those are high numbers for a province outside of Hubei province in China. So 12 and 19 is high for the rest of China. And Iran has 50 in one city, 50 deaths so far this month. So, like the guy from the WHO said, China's doing things right. Of course, Hubei is out of control, but they're getting it under control. But the rest of the country, they got the rest of the country under lockdown, even though the number of cases might not indicate that that's necessary. Some of those other cities are relaxing their rules now. They're allowing people to go outside because they've dropped their level of alert one level. Then the U.S. at 53 cases. Yesterday it was at 35. And again, this is for the U.S. repatriating people from this cruise ship. So, obviously they tested some of the passengers that weren't diagnosed. Well, actually, there were 45 people diagnosed at the cruise ship, but when they brought them back, to the U.S., they only had it as 35 yesterday. Now, I don't know if there was another flight today, or they were supposed to repatriate everybody over the weekend, on Saturday, the same as Australia and Japan. But, it rose to 53 today, but that's not that alarming, even though we were at 16 a couple days ago. The 16, was pretty low, but, all of these new cases are from bringing people back that were sick overseas, and they're in isolation already. All the passengers from this, all the American citizens from this ship are going to be in isolation, for, 14 days or more. And then the people that are sick are going to be, put in hospitals. But they shouldn't be in a position to spread it to anyone else in the United States. So that 53, even though it's a pretty big jump, it shouldn't get any higher unless more cases are confirmed from passengers that were repatriated. And this is a graph. I look at this every few days just to see what trends are. The first several days I put a line through these, and it's almost linear. The number of new cases every day was pretty consistent. Then we went through a little period at the beginning of February till about February 11th, where it started accelerating, kind of curving up for a while and then curved down for a while, and then when you put a red line through all of it, you can see that it's basically linear and that it's just a steeper graph than the first bunch of days. And then the same for the next three. We had a big aberration due to a difference in measuring criteria, due to a difference in defining the criteria for a confirmed case from blood work only under a microscope to other diagnostic tests that include blood work and CT scans and stuff like that. So that is leveling off a little bit from earlier in February, and then I put a line through the next 4 days, and then the last 4 days is almost level now. So things are looking a little bit better, globally, but I think we might see a spike until Italy, South Korea, and Iran get things under control, because we're still seeing rapid increases in the number of cases there. We're seeing decreases in the number of cases in China, which is kind of offsetting what's happening in the rest of the world, where we see increasing cases. So that's why it's flat for the last 4 days. And that's all we had.